My name is Heather Edwall, and I'm Northern Niños licensed clinical social worker. Well, I'm the inpatient social worker, so most of my work happens on the medical surgical floor, labor and delivery, and the emergency room. Sometimes the clinics will call me if they find a patient that needs some more help on the outpatient side. I always find it helpful to compare mental health to physical health whenever we can. So just like any other medical specialty might involve different parts of your body, to me, mental health means our hearts and our brains, how we feel and how we think that either makes it easier or harder for us to do what we need to get done in life. I bet you want me to give you a number, but it's far more accurate to say that almost everybody struggles with a mental health issue at some point or other during their lifetime. We have to consider whether these issues are acute or chronic and how much they're impacting the person that's experiencing them. Going back to my medical comparisons, this would be like coming to the ER after a car accident versus needing regular dialysis or medications to stay healthy over time. Or maybe something hurts. Does it keep you from hiking 20 miles every once in a blue moon? Or does it keep you from getting out of bed and taking care of your kids every day? When you say someone is dealing with mental health issues, it can mean so many different things, including alcohol and drug addictions. And those really are things that we see a lot of locally. Yes, again, mental health problems are most often just normal but unpleasant reactions to too much stress in our lives or something traumatic that happens to us. From there, they get a little bit more complicated, like they're going to be different for people that struggle with depression versus people that have anxiety, for example. But overall, I would say any thoughts or feelings that feel so strong or overwhelming that you can't concentrate on anything else, or any actions that you do and you feel like you want to stop but you can't, those are red flags that might mean you need a little help pulling yourself out of the hole. And I've noticed that panic attacks and losing your temper suddenly and hopelessness are some other symptoms that have really gotten a lot more common since the beginning of the pandemic. I don't think it's hard to understand why. Of course, but it's kind of like asking if there are cures for being physically out of shape. You don't get that way overnight, and you might not be cured overnight either. Plus, it's going to take some effort on your part to get better. But the good news is that getting treatment early helps a lot, and once you figure out what your own personal medicine is, those are the things you've tried that consistently work for you, those skills and activities are usually going to work to improve your mental health no matter what challenges life throws at you next. Whether it's finances or parenting, aging parents, divorce, job issues, whatever. Definitely you've got to tell somebody. I don't care if it's a good friend, a therapist, the person on the other end of an anonymous chat or hotline phone number. It almost always feels better to talk to somebody who's a good, sympathetic listener. Mine personally, no. I'm included for patients of the hospital, and as long as I have time available, I'll talk to community members about all kinds of things if they call me. Do you want the phone number for my office? I'm really lucky. That's the best thing about my job here. I love when I see a former patient out in the community somewhere, like at the grocery store or the coffee shop, and I can tell that they're not drinking or using like they used to. I can't always say hi to them the way that I want to because maintaining confidentiality in a small town is hard already. But sometimes I see people months or years later and I think, wow, they look really healthy now. Or I'll run into somebody who is having relationship problems or trying to get through their kids' teenage years or something like that, and I'll see them with somebody new and that person is treating them really respectfully. Or maybe they're getting along with the kid and they've got their arm around them. It's really rewarding to know that we're all so resilient and we can help each other get through the tough times. I really enjoy getting to work with other agencies in the community, like First Five, AMACA, Wild Iris. Like Wild Iris provides peer counselors, which sometimes help people with their mental health around certain issues. But because they deal a lot with domestic violence, they really get to be specialists in those areas. And it can be helpful for patients to be talking to a peer counselor instead of a regular licensed therapist. Wild Iris is also special because when they first started, they dealt almost exclusively in domestic violence issues. And a lot of people might not know this yet, but recently they've gotten a lot of state grants and things for family issues that affect everybody. And so their agency is a lot larger and they offer a lot of different services that they didn't used to. I hope this has helped everybody see how important it is to take care of your mental health and get treatment if you need it. If anybody has any other questions or wants to chat, you have my number and I hope to get calls from you.